Hospitals in much of the country, those in Nebraska, say they are still short on nurses. Joe Harris is on your side in the newsroom tonight with what could be causing these shortages and what can be done to help.
Aaron, we've heard a lot about pay leading to staffing issues for nurses, but those in the healthcare industry say it goes beyond that.
We do not have a shortage of nurses in this country. We have a shortage of nurses willing to work in the healthcare environments as they exist today.
Rebecca Love is not only the chief clinical officer for the healthcare platform IntelliCare, she's also a nurse. And she says it's tough to keep nurses around.
The healthcare systems are incentivized to staff nurses to the lowest cost denominator.
She says this leads to higher workloads and nurses to make quick exits.
Based on a study that was published prior to the pandemic by Walters Kluwer, over 57% of new nursing graduates leave the bedside within 2 years of practice.
Jeremy Nordquist, president of the Nebraska Hospital Association, says Nebraska hospitals are feeling the strain.
Right now, about 92% of our hospitals are saying they're in a workforce shortage. They say they're in around 8, 9, 10%, depending on the hospital, short. Nursing, nurse aides are at the top of the list.
Nordquist says he doesn't have any updated numbers from the state, but like the national trend, he believes nurses leaving the industry within 1 to 2 years of graduating is around 30%.
This fall, we still had really strong enrollment numbers into our nursing programs across the country and here, certainly in the eastern half of Nebraska. I think in western Nebraska, we have a lot of work to do to continue to build the education interest and pipeline in health professions.
Nordquist says housing and childcare are needed to build that pipeline.
If there isn't adequate housing, it's tough to get individuals to make that commitment to do their education in rural communities.
And also someone to look after their kids.
Usually it's younger individuals and early in their careers trying to figure out how to have and afford childcare and work and make all that work out for them.
He says although the NHA hasn't reviewed them at this time, Senators Mike Jacobson, John Frederickson, and Teresa Eibach have each introduced bills during this session that would address childcare and workforce housing. And if you would like to look at those senators' proposals, we have them linked in this story on WOWT.com. Aaron?
Joe, thank you.